Here on the call today, and we are here to talk about menstrual hygiene and women's health and wellness. Thank you for all the doctors and the eminent speakers who are here, who are participating, and thank you for one and all who have joined the call. It is great that we are doing this small yet powerful session. I'm sure this will bring in change in many people around us, and I'm looking forward for a great churn with this. I want to go about introducing our one of our national advisory council,
The council.
and here I go. Let me just share the presentation. So can you view my screen?
No.
Not
No,
yet?
not yet, not yet.
Okay. One second, it's not allowing me to share window. Okay. Now can you view? Do you see it?
Yes, ma'am.
Visible.
Awesome. So our first eminent speaker is Sharada Garu. She is our National Advisory Council for G100. She is most inspiring person I look up to over here. And ma'am has taught me so much in this period of time from when she's joined. And I look up to her and look forward to learn and change myself to be a better human being. Thank you, ma'am, for being on here. So over to you so that you can give a brief introduction and then we can take it from here.
Yeah. Thank you. Good evening, all. It was nice to get connected with all of you. And I'm Sharada. I'm a National Resource Person for Ministry of Rural Development. And my focus area is on food, nutrition, health, and wash. So I keep conducting sessions on women's health, child's health, and the hygiene part, and the kind of the food they can take, etc. So I have been in this field for the past 25 years, and even as on date, I I think my struggle alone will not give us the required desired results. So we need people like you all who can join us to reach out to the needy and explain them. So why do you think the menstrual hygiene is important as on date? It is very important to know what exactly our body is, what it accepts and what it doesn't accept, how we should take care of it, and what are the best ways to reach out to that. So there are many aspects to that which by which one can reach out. I have conducted many sessions in villages where from cloth to pad the paradigm shift has been made and how we had monitored, etc. So people always have a conception that I know everything. So, but actually they don't know anything and they don't want to bring about any change in themselves or nor in their thinking. So that is where we have to, bulge and get the things done. So this is small change. And bottom for the entire work is education. That is what we are trying to aim at. So over to Kalyani for further carrying on. Thank you.
Thank you. Thank you so much, ma'am. We had actually run a questionnaire and we got the results of it, which we will discuss at the fag end of our call. And thank you, one and all who participated in that particular questionnaire, who answered, who asked us valuable questions, which will be addressed today. And we look forward to go about sharing our answers during the session. So it's going to be like we have gone ahead and slotted each one of our speakers. So they will first give a talk about the topic that they've been given. So they will talk for about 10 minutes, and after that, we'll have question and answers. In case you have any questions during the session while our speakers are talking, they're going ahead and telling us about it, please feel free to raise your hand and ask the questions. In case you are feeling uncomfortable asking, please feel free to type in your questions and we will take it for you and you will definitely get the answers. And that does not end here. You have questions and you want to ask, even at the later point of time, please reach out to us. We will get the answers for you from our eminent dignitaries and we will get back with the answers to you. Any doubts, any queries? Great. So over to Anupama, where she will introduce to us our first speaker. Anupama, over to you.
Thank you, Kalyani. Thank you, Sharda ma'am. So we begin with our first panelist for the day today. I'll introduce Dr. Varsha Prapanna. Dr. Varsha is an MBBS, DGO, CIMP, consultant gynecologist. She is practicing in Baroda since 35 years. She is also an active member of Baroda Gynac Society and Baroda Menopause Society. She is a menopause practitioner and has a rich experience of being a part of national and international conferences and panel discussions. A very warm welcome to you, Dr. Varsha, and thank you for sparing time from your very busy schedule and being a part of this event. Over to you, ma'am.
Thank you. Thank you. So I have to screen share.
Ma'am, I think the settings are given. You can share it.
Yeah. I'll do that.
Wonderful. Probably you may want to enable your video also.
No, yeah, exactly. How do I? Okay. Can you hear me?
Yes, ma'am, we can hear you.
Okay. Can you see my face? Can you see my face? Because I can't see you all. I can't see you all on the screen.
No, ma'am, you may have to enable your screen. Enable your camera.
Okay.
I think it's not enabled.
Okay.
I can see Dr. Varsha.
Okay,
no, Kalyani, we can see doctor's video.
We
You
can
can?
see.
Okay.
Yeah.
Okay.
Okay, then I'll start with the presentation.
So should we go ahead with the presentation, I think?
Yes, ma'am. Please
Because
go ahead.
I don't know how to connect the video and things.
No problem.
Okay, thanks for the kind introduction, Anupama. And it was nice talking to you after so many, many years. And thank you, Kalyani, also for having me on this webinar where I have come to know so much of the work you all are doing. It's so wonderful to be associated with a pan-India team. Thank you so much. And the topic is menstrual health and hygiene. It is menstrual day is celebrated on 28th of May. And why? Because the menstrual cycles average 28 days in length and women menstruate on an average 5 days each month. It is crucial to highlight the importance of menstrual care and raise awareness about the issues faced by women. And that is why we celebrate the menstrual day, or the menstrual hygiene awareness is there. The theme of Menstrual Health Day for 2023 is "We are committed." Definitely we are, and we really need to work hard to achieve this goal. The WHO, that is World Health Organization, also rightly defines menstrual health as a state of complete physical and mental social well-being, not merely the absence of disease or infirmity in relation to the menstrual cycles. So with this brief, I think let's talk about menstruation. Every month, why do girls or women menstruate or why they get their periods? Every month, the uterus lining gets thicker to prepare for a fertilized egg and pregnancy. Basically, it's something like this. The egg, yeah. Can you see my PPT? Hello?
No, we,
Huh?
at least I can't.
Okay, okay. Ami, can you see?
नहीं उसी ने भेजा है मैम
Acha, okay.
Yes, now we can see, ma'am.
Okay. Can you see now?
Yes,
now
yes.
it is now
Yes,
we
yes.
can see
Okay. My face you can see?
yes ma'am we can see your video also
Okay. Okay. So I think I'll go from further from this slide now. So basically, it's like the eggs are released from the ovaries, and if the hormones are enough, and if there is no pregnancy, then this inner lining starts shedding. It's basically that every month the uterus lining gets thicker to prepare for a fertilized egg and pregnancy. If the egg doesn't get fertilized, this lining gets released from the uterus or the body, and it is released as blood through the vagina. This monthly process is known as menstruation. Actually, I thought we would be having maybe some schoolgirls or college girls, so I included such basic things.
No problem, ma'am. We
Okay,
will watch
okay.
this at the later stage.
Okay, knowledge about menstruation is very, very important because it is not a stigma. Menstruation, the cycles are usually, they last for 3, 5, 7 days, 3, 5 or 7 days. It's a 28-day cycle normally. The cycles can vary from 21 to 40 days. Initially, the periods may not come for even 3 to 6 months or 3 to 6 weeks or 2 months when the menarche starts. And sometimes they are highly irregular for 1 to 2 years. This is a normal variation. And the normal menstrual blood loss is 20 to 60 ml. Why is it important to talk about menstruation? Because 52% of the women worldwide are in the reproductive age group, and most of them thus are menstruating regularly, or monthly. Still, the majority of them are not in conditions to take care of their menstruation in a hygienic manner. So menstrual hygiene is very, very important. And menstruation matters. Definitely, yes, because menstruation is natural. It has nothing to do with dirty or bad blood. The myths and taboos on menstruation are not true at all. We all know this. Girls have right to attend schools even during menstruation, and others should take care with respect. There is nothing to be ashamed about menstruation, and we can contribute to breaking the silence. This is directly from the UNICEF. So again, to show that during menstruation also the girls, the women, they can do their regular activity. They can do sports, cycling, they can mix with each other, they can eat all the food, and they can be clean and have a bath. Awareness about periods leads to better reproductive health, great self-esteem and confidence, and better academic performance. There are various beliefs, myths, and taboos. During the menstrual cycle, the girl or the lady should not enter the puja room. She cannot bathe because they think it's a very harmful practice. She will become infertile. They cannot touch a cow. They cannot look into the mirror, touch a plant, or handling of pickles. Even I have seen long back. So this is the picture when the period is over, when the girl's periods are over, she is so happy. And when they are about to start again, what happens? The impact on daily life because of menstruation is great. The reasons for missing school, 93% of the girls have missed school either 1 to 2 days on an average every month. 74% give the reason of physical discomfort or pain. Some 38% say fear of staining clothes, which is very, very common, I think. And some feel shame or embarrassment. Diet is very important during the period when they are having menstruation. Adequate nutrition is very, very important. Green leafy vegetables, high fiber diet, nuts, and mainly adequate water, and fresh fruits. These are the important foods. I think everybody knows about this. And obviously, because of the blood loss, there is anemia. So to maintain the hemoglobin, these are the foods which the girls or the women should take. Sanitary napkin is something maybe basic for us, but not for the people or the girls living in the rural places. They should have a knowledge about the advantages of sanitary napkin. The use and disposal is very easy as compared to cloth. It has absorbent layers, so there's a dry feel. There's decreased chance of infection and helps ease mobility of daily routine work. And you can use any brand. These are the types of pads. I had more pictures, but I just kept this one because it could be ultra thin, it could be extra large, it could be day pad, it could be night pad. It is very easy to carry. No one will come to know.
Excuse me,
How long
ma'am.
can I? Yeah, hello.
Actually,
Hello.
we are not able to see all the slides. It's still only on the
Okay.
Slide number
on the
7.
uterus slide. It is on the
Oh
uterus
my.
slide.
Okay.
Sorry about that. Didn't
Okay,
want to
no,
interrupt.
I don't know. Maybe the problem is from my side. The problem is from my side.
No problem, ma'am. I think this one went off presentation.
Yeah, now we can see it.
Okay.
Yes, we can see that slides change.
Okay. So maybe should I? Yeah, I'll be very fast with these slides. I think everybody knows it. It should not be considered a stigma because it is a very, very normal and natural thing because which pictures? Okay. Can you see this slide? Menstruation matters?
Yes,
Yes.
yes, ma'am.
Okay, okay. So I think this is a slide by UNICEF. You all must be knowing also. Menstruation is natural. There are no taboos attached with it. Girls have right to attend schools. The women
Yes.
and the girls should undertake and they are allowed to undertake all the normal activities. Awareness leads to better self-esteem, esteem and confidence, better academic performance. The beliefs, I think I'll skip because everybody knows and has heard. And maybe when we were children, we have seen in some of our households also.
Yes, ma'am.
Yeah. And definitely, even till now, girls are missing schools and colleges because of the pain, fear of staining clothes. And some girls feel embarrassed when they are having the menses. Diet is very, very important. I'll just put some stress on this. Adequate nutrition, green leafy vegetables, high fiber diet, fruits, and adequate water is very, very important. And proteins, whole grains combats bloating. Hemoglobin has to be maintained because once, if this bleed more, then anemia sets in. And that's why most of the schools are giving 1 tablet of iron a week, I think. Yeah. Is it okay? Can you hear me or see the slide?
Yes, ma'am.
Yeah.
Yes,
Okay.
perfect,
So
ma'am. Perfect.
sanitary napkins are again very easy to use, easy to dispose, and they are comfortable. They decrease the chance of infection, helps in ease and mobility of daily routine work. These are the different types of pads. I think everybody knows about it. And how long can a sanitary pad be used? These are frequent questions which girls keep asking us. So either it is advised to change every 4 hours, but at least 6 to 8 hours would be good enough, or 12 hours at least. And it should not be fully soaked. Don't wait till it is fully soaked. Customize changing schedule to one's need. Discard is very, very important. How to discard your sanitary products or the napkins. Because if you put them anywhere, they attract flies and insects, spread infection. So it is better to wrap them in a paper, maybe brown paper or whatever, or newspaper. and do not flush it down the toilet. Nowadays, I think incinerators are there in many schools, many around big toilets, and all toilets have dustbins. Wash your hands after having cleaned. What if the girls are using cloth? Many places they're still using cloth. Okay, they can, provided the cloth is clean, soft, dry, and absorbent type. If reused, it has to be washed thoroughly, dried in the sun. Better if it is ironed also. And store in clean, dry place. Do not share with others. After multiple uses, it is better to discard them. अवनी ये नीचे नहीं जा रहा है. अवनी ये नीचे नहीं जा रहा है. Okay, यहाँ से है. Okay, this would be a repetition. I'll skip it. So cleaning is very, very important. Use a mild soap or body wash, including your vulva, and rinse well. You need not have a special soap or hygiene wash or anything, but just remember to not to clean inside your vagina. No douches. When to meet your doctor is very, very important. If your periods have not started till the age of 15 years, if periods are delayed or early, if the periods are very scanty or very heavy, or if the periods are very painful and you're not able to attend to your normal activities, that is the time you need to consult a doctor. These are reproductive phases of life. Till now, I was speaking something about from menarche to starting of early menstruation. Then this is the next phase. I think it would be too much to talk about all the disorders. They could be having pain during periods. A lady could be having problems with conception. She could be having heavy bleeding. She could be having scanty bleeding. So I think the other speakers would be taking all those issues. And definitely once menopause is once the lady has not got a period for a whole year, and respected Shaila Ben is there to talk about things beyond menopause. Okay, some issues are pain during periods and mood swings. That is very, very common. A typical symptom of the girls or the women. Why do periods smell so bad? Basically, the foul smell is because of the discharge and not changing pads or tampons frequently enough. This is because blood comes in contact with the air and gives a chance for bacteria to develop. And when these bacteria ferment, this can cause an abnormal smell, and it is a cause of infection then. Then another common question is, why does period look black? It is very simple. It is a normal color change. By the time it comes out from the uterus, if you remember the photograph which I showed, that there is shedding of the endometrium, and by the time it comes out from the vagina, there is a color change because the blood becomes thicker, and temporary thick heavy flow isn't a cause for concern. I am used to conducting quizzes in my societies, in the Gynec Society and Menopause Society. So I have a quiz for you all. Who is this?
Yes, ma'am,
Identify. Yeah? Okay.
Yes.
I have just 2-3 slides more.
No problem. Please go ahead, ma'am.
Yeah. So I'm sure everybody of you know he's Arunachalam Muruganathanam. He's period man or pad man of India. He invented the low-cost sanitary pad making machine. And everybody, I think this person, he revolutionized after his movie Padman. I think everyone in the rural areas must be also using sanitary napkins after him. Who introduced the first sanitary pads? It was Johnson & Johnson in 1896 who introduced the sanitary napkins, and they called them Lister's sanitary towel for ladies. So I think this is the end of the my talk, and I'm sorry for whatever glitches were there. And I'll stop sharing now. Hello?
Yes, ma'am.
Yeah.
Yes,
Okay.
ma'am. Absolutely fine. No issues.
How do we go back, Avni? How do we
Anupama, we want to take up and ask the questions.
Yeah, I'm very sorry. I'm very sorry for whatever problems were there.
No problem, ma'am. We are all well versed with that. All of us go through the same thing. And I keep saying technology becomes super friendly when we are trying to be friendly with the technology.
Yeah, actually, normally I send my presentation to the whoever is conducting, but this time I thought I'll be able to manage.
That's okay, ma'am. Absolutely fine, because we are all well versed with it. We agree with it. So no issues. So Anupama, you want to take the questions? You may have to unmute, dear. Anu, you have to unmute.
Hi, Varsha.
Yeah, hello,
Hello.
Shaila Ben, hello.
Hi. I was very impressed by your presentation, but my point, or what I thought, all these meetings are for touching the people who really do not know what is hygiene. We are talking about the school going, the children. Children going to the school are from maybe middle class, upper middle class. What I want to see is to touch the lower class, where
Yeah.
things
So,
should be done, because
yeah,
I have adopted one village and
yeah,
I go there and I
yeah.
get lot of pads from the
What was the
other
village
people
where I
also,
went? Name of the village? Uh,
but they don't know how to use it. They don't know what to do.
yeah.
Even they think about the lady coming into my house to get it
Garjan ke
cleaned up
aage.
every monthly because of her socio-economic condition. That too also in Baroda.
Yeah,
Every monthly she has one daughter. I give her two packets of pad and a soap. I think we should be touching those levels rather than people who can afford. They know what is hygiene.
yeah,
People who can do, they know what to do with it. We have to go to rural areas, form some committee rather than sitting here talking on a dais, going to their families. This is
yeah.
what my idea of looking after the patients and their hygiene is.
Shaila Ben, before COVID, I have done lots of awareness programs in schools. I had gone to a place near Karjan. There, I'm forgetting the name of that place because now it's 3 years, and only one bus goes and comes back in the evening. You can imagine how remote it must be. So I have tried through our, of course, society and other people. I have tried to go to so many schools in Baroda as well as around, and
No, that is very good. You are doing it, but I think all of us should do some commitment to some society, because our class do not need it. Middle class don't need it. What is needed is by the poor people, by the rural people, and that is what I feel the society and the platform is for. This is what personally I feel. I
Ma'am,
may be wrong.
I beg to differ here, ma'am, because one simple example I want to give is we all travel by plane, and how many of the airport toilets you have seen where napkins are not flushed? I mean, napkins are flushed and the toilets are clogging. How many of the bus station or railway station toilets you have seen where napkins are just thrown, or girls are still struggling? Not only girls, ladies are struggling. Awareness is needed at every class, because it's an assumption or a myth that middle class or upper middle class or high class people don't require. All of us need. And today it's become in such a way that they are feeling very shy to ask these questions. They are feeling very shy, because for me, when we shared the form, there was at least, we approached at least 300 plus people. We hardly got around 100 responses. Out of that 100 responses, 38 responses were through the forms. Remaining people only shared the questions through WhatsApp. I hope you can understand why people are very skeptical to even talk about it. And these are the people who use internet, who are taking calls regularly. I can imagine what will be the state of the women or girls who don't use these. So it is there everywhere. Only thing, we have to reach out, we have to take subtle ways to make people open up and ask questions. This is my learning.
Maybe we as our parents, we lack to educate our children. Sometimes our children also do something which really shames us. I think all of us have the same experience. We can start from our own house, our own children. I mean, that is very general. We are at the moment talking about menstrual hygiene, and we are talking about menstrual hygiene. Lot of people know, but most of the people really do not know in the rural area. So we are not talking about people, these people will never go to the plane, though the plane tickets are very significantly have reduced. So why talk about those who go in the plane? I am talking about the people in the rural area. We are touching the basics. I am
That will
not going
also
to
be.
touch.
No, ma'am, we'll plan to do that. In fact, one of our project that we are doing, we are reaching out to schools, we are reaching out to government schools through the project, because if we say we are doing only this, we getting permission is very less. We have seen that throughout last year. So this year we are going with climate action related activities, and through that we are creating awareness about menstrual hygiene,
I think we can go on
women
about this debate
wellness.
because your ideas are different, little might differ. Everybody's idea differs a lot. This is a basic thing I want to say.
But
That
see,
let us
Sure,
touch
ma'am.
these people.
I'm in a
We don't touch
semi-urban.
the upper class and the people going in a plane. We touch the people in the villages. That is what I'm trying to tell you. Because I have
Sure,
really
ma'am.
adopted one and I'm finding it very, very difficult in spite of taking soaps, in spite of taking this and making frequent visits. Now, none of us can go every day anywhere. Let us be honest about it. We are not that sort of a social worker. We talk a lot, we do a less work. So I'm just trying
Yes,
to
ma'am.
put my point forward that if we can all help somebody like that, it would be nice.
I
Got
think
it, ma'am. We'll look into it.
we all are doing. Most of the time, we all are doing. And even Shaila Ben, see, I'm in a semi-urban place. Even there, I find that lot of this awareness and education is needed. Even here, I find that people are still using cloth and whatever. Like, and we are trying from our side. And just like you say, we should try to adopt maybe villages or
Yeah, we all can afford
yeah,
to do that. At least
yeah,
2 villages, we
yeah.
can make a difference in our
Suggestion
lifetime.
taken. Yeah.
It's a beginning.
Sure, ma'am. Agree with
Sorry
you.
about that. Sorry, Varsha.
No
No, not at
problem,
all.
ma'am.
Not at all. You are my
Over to
guru.
you.
You are my guru. You know
Listen,
that.
listen to me. I have been always different than others. So you have to bear with me.
No problem, ma'am.
Okay.
Over to Anu.
Yeah. So thank you so much, Varsha ji, for this very, very informative talk. There are a few questions that we've kind of made a note of from all the inquiries and all the forms that were submitted to us, and I'll just take a few of them from here. So the first
Okay.
question is, I always worry about only to 1.5 day. So my doctor says that as age progresses, it's bound to reduce. So this is one question put up. So Dr. Varsha, it's addressed to you. I'm
Okay. Okay. So she says that as her age is advancing, her periods are becoming lesser. I think that is her
Her
question.
flow. Yes, her flow
her,
Yeah.
tenure for the flow is
Flow.
less.
Flow is okay. Okay. See, basically, what happens with advancing age? Definitely, the hormones also tend to become less. The ovaries start functioning little less, so the cycles become little shorter, longer, whatever. There is some irregularity, and so the flow comes down also a little bit. And but we can't call it menopause till exactly 1 year has passed and the lady has not menstruated, so she's not yet menopause. And sometimes there are other reasons also, like excess weight gain, or sometimes weight loss, because in such cases again there is a imbalance of the hormones. Sometimes the woman is taking OC pills, the contraceptive pills. In that case also the flow decreases a little bit. Or if there is anemia, there is an overactive thyroid, so basically then or there is stress also causes flow to reduce. So we have to investigate.
okay.
Wonderful.
Um,
Thank you,
okay,
ma'am.
so thank you. I'll go on to the second question. Pardon me if I pronounce it wrongly. Dysmenorrhea is one of the most common concerns for menstruating women. However, many know how to manage it. Now, visiting physicians is also unfruitful as 99% of them project that it is a norm, which obviously is not the right.
I couldn't hear the last part, Anupama. Last in norm.
Okay.
Some say that it's a norm after that.
So visiting physicians
Goes to a physician.
is also, going to physician is unfruitful as 99% of them project that it is a norm, and which obviously is not the right thing to do. How do we as women solve this issue?
Basically, see, like physicians are going to say it is a natural phenomenon. They are going to, like, even if a girl or a lady comes to me, I would always tell her first, reassuring that this is absolutely a normal and a natural thing. And what happens, the uterus has a normal tendency to contract and relax. Basically, this is going on all the time, and whenever there is the shedding, like I showed in that photograph, the uterus contracts to throw all the shed material out, or the menstrual fluid out. So because of that, the muscles and the blood vessels also contract. So the girls or the ladies, they get dysmenorrhea or pain when they are having the bleeding. It could be a slight discomfort or it could be a severe pain. It is individual, how she perceives it. And actually then she should take some mild painkillers. I usually tell them it will go with paracetamol. That is the best thing to do, or some hot fomentation or something like that. Is it okay? Satisfying answer?
Yes, thank you so much. I'll go on to the next one. So there has been a reduction in flow, and she is using just 1 or 2 pads and has recently started to experience menstrual pain. So she wants to know what she should do.
Okay, yeah. So obviously she should go to a gynecologist and get herself investigated. Sonography would be most important, and some blood tests also. Always thyroid and blood counts should be done. And for her pain, just like I said, some heat pad, or and rest is very important whenever there is this painful condition. Rest helps a lot. Exercise which would relieve her pain. Painkiller medicine, paracetamol is the best. Otherwise, there is mefenamic acid. Nowadays, girls bring the prescription of Meftal spas they have already taken, that sort of thing. And sometimes, avoiding salt, caffeine, of course, alcohol is no. And sometimes massaging of the back and also helps in painful menses. But basically, if she's having less bleeding, then she needs to consult someone.
Okay. Thank you.
Great.
We have another question where lady wants to know that are there any medicines that can be taken to avoid menstrual pain? I think you just answered all of that. You just gave us a
no,
list.
there's nothing to avoid. But whatever, like I said, she should take care. That definitely some vitamins help. Vitamin B6 is very good. If they are taking vitamins and minerals and plenty of liquids, and against stress, she should do some meditation. That will also help. But there is no medicine which, if she takes, will avoid her pain.
Okay.
Awesome.
Thank you. So my last question for you would be,
Dr.
lady wants to.
Dr. Shaila wants to
Hello.
speak. I think she's on mute. Yeah.
So my last question would be for Dr. Varsha. So lady wants to know how to reduce cramps. Why are period pains normalized by women in the society? So this lady faces regular, very painful periods and wanted to know the remedies for that, and what to eat during menstrual periods to avoid pain. Specifically, if there is any food item that can be eaten and that could be helpful in reducing the pain.
Avoid salt, avoid caffeine, plenty of liquids, plenty of rest, and heat pad definitely helps.
Okay.
If provided in the sonography, there is no lesion, there is no any abnormality in her uterus or outside her uterus in the ovaries. That
I
has to
see.
be cleared first. Only then
Okay.
these measures will help.
Okay.
Great.
Dr. Varsha,
Ma'am,
thank you so much.
Anu, there is one more question. I think Indu has asked the question
Yep.
here. What are your thoughts about menstrual cups? Ma'am, would you like to address that?
Uh, yes, okay. Nowadays, many girls and ladies are asking about cups. I think I had a slide, but right now I'll not be able to show you all. Nowadays, many girls and women are using. So I think it is safe to use, provided they know how to use it well. And there are two types: silicone or rubber. Again, it has to be changed every 12 hours, and in a way it's better because it is eco-friendly. Then it comes in different sizes: small, medium, and I think smaller for ladies or women younger than 30. So, and of course, it is better to meet the gynecologist. Like, I have a few girls who come to me, they ask me how to insert, they learn it from me. So, that is a better way. And some girls just do it on their own, and if they have a problem, they come and ask. So, it is okay to use menstrual cups.
Wonderful, wonderful. Thank you so much, ma'am.
Can
Really
I
an
can I
honor
put in,
and pleasure. Yes, ma'am,
can I
please
put
go
in a
ahead.
word? Can
Yes,
I
ma'am.
put in a word? Hello,
Yes, ma'am,
can you
please.
hear
Yes,
me?
we can hear you. Yeah.
Yes, ma'am.
I would about the dysmenorrhea. If the girls can be really taught up, there are only 4 exercises, yoga exercises, and
Yeah,
it
I
can
forgot to
help
mention
people and
yoga.
it has helped people. If we can introduce without giving medicine, without doing that anything
Yeah.
of that sort, I think that will help the parents also and the ladies who are
I
getting this
mentioned meditation.
later on also.
Yeah.
It is the exercise,
Meditation
not the
also helps.
meditation. There are 4 exercises which are available online also. A yoga teacher, you can go to the classes. You can learn now in the gardens also. They teach you free of charge. There are so many facilities available. Rather than going to gynec, rather than going to this, that, if we can introduce yoga, I think it would be good for the parents also and for the child also. This is what I strongly feel. Thank you.
Thank you, ma'am. Thank you so much, ma'am.
Thank
Thank
Wonderful,
you.
wonderful
Thank you.
session with Varsha, ma'am, and thank you, Dr. Sheila, to pitch in and giving your valuable advices. It's really nice. Now, over to Nirja. She will go about introducing our next doctor. So, Nirja, please take over.
Yeah. Thank you, Kalyani, and good evening, everyone. Good evening to all the doctor panelists in this session, and good evening to all the G100 members who have taken time. Uh, uh, may I have Dr. Malik turn on his camera? Are you able to, Kalyani, are you able to see Dr. Malik online?
Yes.
No, probably
We
sir may have to talk a word or two, then I'll be able to see.
Yeah. Hi. I guess
Yes,
must be
sir.
able to see right now. Yeah.
Yes,
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 sir.
yes. Yes, doctor, we can see you now. Thank you for
Yes.
turning on the camera. So I take this privilege to introduce Dr. Malik Singaraju, an eminent and very experienced radiation oncologist from Hyderabad. He is right now with Continental Hospitals and having an experience of almost overall 17 years. He founded the Singaraju Cancer Foundation and is involved in various cancer awareness initiatives. Dr. Malik Singaraju is an alumni of Kasturba Medical College, Manipal, Karnataka, having passed out MBBS and MD from this deemed university and institution. He has also received Guinness record for participation in largest simultaneous breast cancer screening camp in the year 2016, and he also has received Vaidya Ratna Award for services rendered to the community. And adding one more to his hat, he has received Health Conclave Business Mint Award in the category of the Best Radiation Oncologist in Hyderabad for the year 2020. So thank you, Dr. Malik Singaraju, for joining this session, and we would all look forward to your inputs and your suggestions and advice. So over to Dr. Malik Singaraju.
Thank you so much, G100, for inviting me. Uh, Good evening, everybody. And today we are talking about a very important topic about menstrual hygiene, about awareness regarding menstruation and postmenopausal care. And it was a very crisp presentation by Dr. Varsha. It was very nice and nice to see the views of Dr. Shaila as well. And not only, I believe, not only the girls, but even boys should be sensitized towards the menstruation and the challenges faced by girls, especially teenage girls and women in the process of menstruation. And being an oncologist, my perspective will be a little different when I'm talking about menopausal, uh, uh, poor menstrual hygiene, and we're talking about postmenopausal age group. As an oncologist, the moment we talk about some postmenopausal female, we think about various type of cancers we see in that age group. So there's many cancers we see in that age group, but most important and most common is cervical cancer. But there is something very interesting observation I'll tell you. So maybe 2 decades back, see whatever I'm speaking, Dr. Shaila and Varsha must have been encountering in their practice in the last 2, 3 decades. So maybe 2 decades back, cervical cancer was very common post-menopausal women. But now we are seeing cervical cancer in much younger females, as early as mid-30s and late 30s. And one more thing, previously, till recently, cervical cancer was number 1 cancer in South India. South Asia. But now, since past few years, maybe a decade, breast cancer has become most common cancer. But still, cervical cancer is most common in rural areas and low socioeconomic areas. That's what actually Dr. Shaila was trying to emphasize and tell us, because even now it is very common in rural areas, and where there is poverty, where there is lack of education, it is still very common. And it's mainly because of poor menstrual hygiene and unhealthy sexual habits. And most of you are aware that human papillomavirus is one of the most common cause for cervical cancers. Apart from human papillomavirus infection, there are many other causes we find, something like smoking or any immunosuppressed conditions, like someone is having HIV infection or somebody is taking medicines which reduce the immunity, or other sexually transmitted diseases. But still, human papillomavirus is known to cause cervical cancer. It is most commonly associated with cervical cancer. And the risk of infection with human papillomavirus increases with risky sexual behavior. When I say risky sexual behavior, that means having sex at an early age, having multiple sexual partners, unprotected sex, and similarly, poor menstrual hygiene. So, what here we have to understand is the symptoms of cervical cancer. The most common symptoms of cervical cancer are post-coital bleeding, that is, bleeding after the intercourse, post-menopausal bleeding, pain during intercourse, and pain in the hip region. And these symptoms are common in many infections and some hormonal conditions. So when somebody is having these symptoms and these conditions, they should not get panicked. The first thing they should do is they should visit the doctor and get evaluated what exactly is the problem. And if turns to be a cancer, then they have to visit an oncologist. But here, the most important agenda, especially when I'm concerned with G100, is early detection of cancer and prevention of cancer. So when it comes to early detection of cancer, there is something called as screening. So what do we understand by screening? Screening means catching the disease or identifying the disease much before the symptoms of disease or the frank cancer is evident. Usually, there's a lag of few months to few years before the cancer actually manifests. See, from the time the cancer changes start in the body, till the symptoms, whatever I have mentioned earlier, till the symptoms appear, it takes several months to several years. So catching the disease early is the key here. There will be always a critical point where we can catch the disease early. So that is called screening. So what is the importance of screening? Why we have to catch the disease early? See, as I mentioned earlier, many cancers are diagnosed in rural areas. Till even today, every year 60,000 females die of cervical cancer in India. That's because 60% of cervical cancers are diagnosed in third and fourth stage. So when we are able to catch the disease at an early stage, what you call a zero stage, it is completely curable. So we have standard guidelines by WHO. That is, the screening is done through pap smear test and HPV kit. But most of the centers, they have pap smear kits alone. And the ideally the guidelines say we should go for screening from the age of 25 years till the age of 65 years. But maybe in a country like ours, it may not be possible to go for screening at a very early stage, but still at least from the age of 35 years, we should all go for screening regularly. There are some centers where both pap smear kit and human papillomaviral kit both are available. In case when both are available, and when the test is done, if it is negative, both HPV and pap smear both are negative, then they can go for next screening after 5 years. But most of the centers, they have only pap smear test available. So if pap smear test is normal, they can repeat the test after 3 years. But in case any changes are found in pap smear test, or the patient has a history of human papillomavirus infection, or any previous history of cancer, they have to go for regular checkup as early as yearly checkup. Then the most important, after early detection, the most important area of focus is prevention. So how do we prevent? The most important, the most important way is to adapt a healthy lifestyle. That is avoiding smoking, alcohol, having a balanced diet. Apart from that, creating awareness regarding healthy sexual practices and healthy menstrual practices is very important. So apart from that, now we have vaccines available. Since last decade, vaccines have become very popular. So vaccines are available against human papillomavirus. Currently, Cervarix is the vaccine quite popular, and it is going to go off label. And nowadays, Gardasil is a new vaccine is going to come into market very soon. It acts against 3 or 4 variants of human papillomavirus, and the guidelines say that girls should receive vaccination from starting from the age of 9 to 12 years till 45 years, and they should receive 3 doses of vaccine. But the recent guidelines, this year guidelines which are released in March, they say only 2 doses are enough. But whatever it is, vaccination helps in preventing. Even if someone has already had an infection with human papillomavirus, they should also take vaccination. Because if once we detect cancer early, cancer can be curable. And as already Nirja mentioned, we have a Singarazu Cancer Foundation, which is located in Hyderabad, whose mission is to create awareness regarding cancer and early detection of cancer. So, in association with G100, we have been conducting various cancer awareness initiatives in cities where people have access to healthcare. And we are going to both rural areas and low socioeconomic areas, and we are conducting cancer screening camps. So, we are conducting not only for cervical cancer, we are conducting screening camps for oral cancers, breast cancer, cervical cancer, and we have both physicians and gynecologists with us. So, whoever wishes to conduct awareness camps in their areas, both online, offline, or screening camps, we're always open for them. And definitely in association with G100, we are going ahead to create a better and healthier society. Thank you so much.
Wonderful, wonderful, sir. So, Nirja, would you like to pick it up and go ahead with the questions that?
Sure, sure, Kalyani. Thank you, Dr. Malik, for your valuable time and the insights given to all of us. So we have a set of questions May I go ahead with the questions, doctor?
Yes, please.
So there is one question. One question says, I would like to know about cancer due to poor or bad hygiene during periods. Is there something like that?
So here, actually, what I would like to say is usually poor menstrual hygiene and unhealthy sexual practice, they go together. It's not, I said, that's because of lack of proper education and less access to the proper healthcare facilities and awareness. So someone is having both unhealthy sexual practice. Usually, they are high risk of developing HIV. HIV itself causes variety of cancers, and even if someone, as Dr. Varsha was mentioning, if they're not changing the pads regularly and somebody is not aware of their menstrual hygiene, even they are also at risk of developing various infections and even to some extent human papilloma virus. So definitely there is a chance of developing cervical cancer.
Thank you, Dr. Malik. May I go ahead with the other question? So one more question is, there is a saying that PCOD or PCOS, if not treated, may lead to ovarian cancer. Is this true?
See, uh, early diagnosis and treatment of PCOD has become a very important aspect of preventive healthcare of late. Maybe since last decade or so, it has become very important aspect of preventive healthcare. When it comes to PCOD, it's a complex of elevated estrogen, obesity, nulliparity. So not only ovarian cancer, PCOD can increase the risk of endometrial cancer, ovarian cancer, and to some extent breast cancer as well. So it has to be identified early and treated.
Noted, doctor. So may I take up another question? Uh, so we have an inquisitive question here. It says, use of what menstrual products can lead to cancer, and how can these be avoided? How can, if a knowledge of what is the right product to use during menstruation which will not lead to cancer, will that prevent cancer? Any insights into this?
Yeah, of late, there have been few studies indicating that the products which are used in the regular sanitary napkins, they cause a variety of health issues, starting from allergy to the cancer by the products used in the sanitary napkins. And also they're posing a threat to environment. So nowadays, more and more people are shifting towards biodegradable napkins. A lot of talk is going about biodegradable napkins, and as Dr. Varsha has mentioned about many people are shifting towards menstrual cups as well. So maybe shifting to biodegradable napkins and menstrual cups would be better in case. See, as such, the issue is, as Dr. Shaila was mentioning, getting access and buying the normal pad itself is becoming difficult nowadays. So biodegradable napkins, even the government has started an initiative. Biodegradable napkins are much costlier than the normal napkins. So we should get into some system where the price is much less. At the same time, the giving access to more biodegradable or environmental friendly products would be more beneficial.
Thank you, Dr. Malik. We have one more question. So this question says, what tests should women undergo regularly to check for any unwanted cell growth?
See, as I was mentioning, if someone goes for a regular health checkup once in a year, usually you'll find many abnormalities in the health itself. But we already have several screening packages available for both breast cancers, where the mammography can be done at the age of 40 years, cervical cancers, colorectal cancer. There's so many screenings available. So through them, they can get diagnosed early, detected early.
Okay. So as Dr. Malik had mentioned about vaccination to prevent cancer, so we have a female who is almost 40 years and over that. So she was skeptical about this particular injection, which can, there was an advertisement which can be taken between 35 years to 42 years to avoid cancer. So the question is it really true that above 40 years, if the female takes this injection, will it prevent cancer? And is there any prescription required for this?
Yes, as such, the standard guidance say the females should take vaccination till age of 45 years. That is the standard guidance, but there are several suggestions coming recently from various gynec bodies that people can take vaccine till age of 65 years. See, when we are suggesting screening till age of 65 years, why not take vaccine till age 65? That is the suggestion from various bodies coming up recently, but definitely till 45 years is the recommendation. But off-label recommendation, yes, people can take even beyond age of 45 years, and absolutely it must be under medical supervision. They can't take on their own. They should visit to gynecologist and they should be taken under medical supervision.
Thank you for the valuable insights, Dr. Malik Singaraju. I think we can, with Kalyani's permission, we can open the forum for any other questions from any of the participants or the panelists.
Yes. Any other questions here? Please feel free to ask directly, or even you are welcome to type. We'll take it. I mean, it is really informative to know about the screening process and vaccination being available. I think it becomes our responsibility now to share what we have learned to people around. I feel uh, we all bear that responsibility. So
I think I don't see any questions from anyone. Thank you, Dr. Malik, for joining us and for your valuable time.
We have one question.
yes, Nishita has asked, does someone prone to UTI be susceptible to cervical cancer?
No, definitely no.
Okay.
Indu had some question.
No, I was just saying that Nishita had a question, but thank you so much for this session, doctor.
Thank you so much.
Wonderful. Thank you, sir.
Kalyani and
Thank you
Indu
so much.
cannot have any question. They are sitting, the back view of what they are sitting is so beautiful. I've been admiring that actually. You two can't be having any questions. The
Thank
way
you,
you are
ma'am.
sitting, honestly, it's a beautiful environment.
Thank you, ma'am. It's just the bag. It is just the background screen that I chose from the list given, ma'am.
It's beautiful. And how about you, Indu?
Yeah, I
Where
think
are you
same here.
sitting?
I'm at home, though I have a equally beautiful background, but I've chosen from a Teams right
You
now.
can give us your address. We can sometime visit you.
Please,
If you
please.
allow it.
I background is also good, man.
Just interrupt, sorry to interrupt. Shailaben, some years back, I attended a webinar and the background was of a beach and the trees were, palm trees were moving. So I asked that speaker, where are you sitting? So my daughter shouted, don't you know this is the background screen? So it's like that.
It's actually wonderful having background screen because it covers up a whole lot of things whichever direction we sit.
Yeah.
I wish we had.
Looks good. Anything is good which looks good. It's
Yes,
that.
that is true.
Wonderful.
Anyway,
Thank you, Dr.
Just
Malik.
the lighter part of it.
Yes.
Yeah.
Thank you, Dr. Malik. That was really informative. And I'm sure, as I mentioned, now it's our responsibility to start sharing with our friends and our community around us and create awareness because I personally
Mm.
for it, so I know how difficult it is. I think we have to personally act on that. Now,
Sorry, Kalyani, I can't hear you, darling.
Ma'am, I said
something
it's our
wrong with my
responsibility
ear?
No. For a few seconds, her screen was frozen.
Yeah.
Now it is audible.
Oh, okay, maybe the internet is just fluctuating.
Probably.
So
Yes.
And over to Anupama to invite the next speaker. Anupama?
Yes. So I'll request Indu to please to introduce our next speaker.
Thank you so much, Dr. Anupama, and thank you very much, Dr. Varsha, Dr. Malik. Actually, you have set the bar so high, and for such a phenomenal kickoff on this very, very important subject. And before we go to our next panelist, on behalf of G100, I would like to express my sincere gratitude to all of you present over here on the call and sharing such an insightful session on hygiene, menstruation hygiene. Myself, Indu, I work as an HR business partner for Buyer R&D, and I am also member for G100 VAPI Chair. And it gives me an immense pleasure to introduce our next panel for today, Dr. Ami Rahitkar. So, Dr. Ami, welcome and thank you so much for your valuable time. So, Dr. Ami is a fetal medicine consultant and director at Anika Fetal Medicine Eye and Heart Care at Nagpur. Dr. Ami, she is an MBBS and she has MS in obstetrician and gynecologist. She is also gold medalist in the subject from Government Medical College in Baroda. She's also a fellowship, completed fellowship in ICOG at Hyderabad and very active NOGS member, which is in Nagpur, which is also a gynec society over there. She is an ex-senior resident at Lok Nayak Hospital and MAMC at New Delhi. She is also a member of Federation of Gynec Society of India and has also advanced infertility training course completed at Shri Gangaram Hospitals in New Delhi. She is also a certified Indian menopause practitioner and a post and also have done various poster presentations at SOGOG state level conferences. So very, very happy to have you here. And to my surprise, she is also a professional vocal classical music trainer as well as Kathak dancer. So what all you have in you, Doctor, and we take it all the privilege to have you here today with G100. Thank you
Thank you
so
so
much.
much. I hope I'm audible.
Yes.
Thank you so much for this wonderful introduction, Hindu. And I'm very thankful to Anupama ma'am for this lovely opportunity so that I can connect to so many people. And thank you all G100 members for this. So I'll start sharing my screen, I think. So I think now the first slide is visible, right?
Yes, visible.
So good evening, everyone. I'm Dr. Ami Rahatekar from Nagpur, and today I'm going to talk about pregnancy and post-pregnancy period, its challenges and solutions. So the day we get to know, when a woman gets to know that she's pregnant and till the day she delivers, that period, the whole period is full of challenges. It's full of joy. It's a roller coaster of emotions, and it's extremely overwhelming. So being a mother is learning about the strengths you didn't know you had and dealing with fears you didn't know existed. It's a very big change for a woman. It's like a rebirth. So the challenges that she faces are usually they can be divided into three: physical, mental, and social. So physical challenges are basically the changes that happen in her body. They can be divided into physiological changes and pathological changes. So the physiological changes are those changes, all the systems in her body, like starting from the central nervous system, the respiratory system, the gastrointestinal system, the cardiovascular system, her skin, every part of her body is undergoing certain changes during pregnancy. She'll feel a lot of bloating, she'll have a nauseating feeling, and there will be breast tenderness, there will be increased frequency of urination. And all these changes are the things that she faces normally in a normal pregnancy. And there can be certain physical changes which are pathological, as in they are seen in a few percentage of women, which are basically complications of pregnancy, like her sugars might increase, which is known as gestational diabetes. That is the patient develops diabetes only during pregnancy, and her blood pressure might increase, that is hypertension during pregnancy, and certain other conditions where her liver might get affected, or her platelets, that is the coagulating factor in the blood, might get affected. So these are the few physical challenges that a woman might face. Second comes the mental challenges. In a very short way, we can say mood swings. These mood swings come because of the excessive hormonal imbalance and the physical changes that are happening. The woman might get overwhelmed because of that, and might have, maybe she's happy for some time, and then because of these challenges that she's facing, she might have a feeling of depression maybe. And there is also a lot of fear of future, that is anxiety. The patient might face a lot of anxiety. And the third challenge that she faces is social. That can also be divided into personal, familial, and professional. The personal challenges are everything that's happening with her body. She might not be able to cope up with it, or there might be these changes, enormous changes that are happening. How she perceives them can be a personal challenge for her. There can be familial challenges, like a lot of advices coming in from here and there, from all sorts of relatives saying you should eat this, you should exercise like this, certain familial norms that you do not do this, or there is a lunar eclipse, you cannot go out. All these are also challenges. And then there is professional, which in today's time is very much important for us to understand, that the woman has to also maintain her profession. There might be certain professions where the woman might be given certain relaxation, but there are other professions where it might be physically tiring for her, like if she's working in the police, or she's a emergency care doctor, she might have to work for 24 hours. So all those challenges are there. And then post delivery also, many times in a private sector, you might not be getting a maternity leave to look after your child. So these are the enormous gamut of challenges that the woman has to face during her pregnancy and post delivery. Basically, just for to understand the basics, the pregnancy is divided into three parts, trimester, according to trimesters. The first trimester is the first, second, and the third month, which is starting from the first week till the 13th week. The second trimester is the fifth, and the sixth month, and the third trimester is the seventh to the ninth month. So basically, each trimester comes with its own challenges, which we will discuss now in detail. The first trimester usually comes up with the patient might feel nausea, vomiting, cravings, and aversions. She might not like certain smells, and there is a heightened sense of smell and mood swings. The second trimester comes with the little baby bump, which comes out, and there might be lower abdominal pain due to round ligament stretching. There might be breast and nipple changes, stretch marks, which is very important in today's times, where most of the patients come to us and tell us that will these stretch marks go away, and why are they developing, how to prevent them, and feeling the baby moving inside you, which is a wonderful, actually a beautiful feeling. And then comes the third trimester, where there are strong kicks from the baby. You might have swollen feet because of the uterus compressing the veins inside the legs, and there might be leaking from breast, frequent urination, and you might feel fatigue. You might feel like actually resting all the time. And then post delivery, the postpartum, as we call phase, there is lochia, there's fatigue, there is engorgement of the breast, and there is a risk of postpartum blues or postpartum depression. So basically, when a woman delivers, it's a big change for her. Suddenly, the attention goes to the baby, and she's the one who is nourishing and providing for the baby. She is sleep deprived, and there are so many people who are advising her this and that. She might be judged for being, for her judgments, like if she wants to take care of a baby in a certain way, she might be judged accordingly. So all these things cause a lot of stress in the woman. And especially if she's a working woman, she has to go back to her work, how she'll manage the baby. All this can make her very prone to postpartum blues. And if there is severity, the severity increases, it might turn into postpartum depression, wherein the woman starts disliking her own self. There is a lot of change in the body. There might be disliking her baby, and it needs help. Matlab, the woman must see a psychiatrist for this condition. So these are the challenges that a woman faces. So how do we deal with these challenges? So the basic rules that we need to follow during pregnancy and post delivery, in very short, our first thing is the diet. It should be very nutritious, as in the proteins, carbohydrates, and fats should be proper. The minerals should be proper. Vitamins should be proper. Proper colorful plates should be there. There should be a lot of fruits of different colors, and also green veggies and some raw veggies as well, like carrot and cucumber, like that. And no junk food, no outside food. If you feel like having certain things, then you might prepare it at home and eat it. Second things are the supplements that the doctor gives them, that is iron, usually an iron tablet, a calcium tablet, and protein powder. So these are the things mostly during pregnancy and post delivery. During delivery there might be blood loss, and you have to prepare the woman for that blood loss and to maintain her hemoglobin, and that iron helps in it. And calcium for her own bones and for providing to the fetus a proper nutritious milk. Calcium is required. And protein powder, again, today in today's time the protein powder is having lots of vitamins and minerals that are required, and it very much supplements our diet. In case there are certain missing things in our diet, the protein powder will take care of it. And the woman initially should start with taking 2 tablespoonful of protein powder in 1 glass of milk, ideally. And if there is some milk allergy, she can take it in warm water as well. And then later on, it should be taken twice a day. And the protein powder, we must take care uh, if possible, it should be whey protein and not soya protein. And also, it should be sugar free. These two things we must check. Then the third thing is regular doctor visits as recommended. Physical activity should be mild exercise and walking if not contraindicated. In certain patients, we advise complete bed rest or strict bed rest, wherein they have a history of preterm delivery, as in before the baby had completed its complete maturation, the baby was delivered. If there is such a history, or if there is a sign on the sonography that shows that the cervix, that is the mouth of the uterus, has become short, there is high risk that the woman might deliver preterm, and the preterm baby needs a lot of care and ICU. There might be risk of mortality also in such a baby. So physical activity after asking your doctor, but if there are no complications, then mild exercise and walking is advised. Yoga and meditation for stress relief is very important if you can do it. And today, nowadays, there is thing coming up for Garbha Sanskar, which is very good. You can apply for those courses and do Garbha Sanskar. It's very helpful. And also take help from family and employ help. Don't shy away and do everything on your own. If you require help, for example, if you're working and you need a helper or a maid to look after your baby, then there's no don't mind in doing all those things. Keep your for your physical and mental well-being. If you need help from family and help from outside, please take it. And last but not the least, this is very important. Me time or self rejuvenation is extremely important for the woman. You must take out some time for your own self. Just don't exhaust away yourself in these in this process of becoming a mother. Otherwise, the you won't enjoy the motherhood phase. So, acceptance of the situation when you're pregnant, you must understand that you are not the first nor the last to be pregnant. So, accept the situation gracefully. Be grateful for being chosen to become pregnant, because in today's scenario, when I see there are so many patients who are facing the problem and issues of infertility, because these days women are studying more, and they're getting married late, and all these issues and the lifestyle that we follow many times, eating outside, excessive stress, even in men, um, some smoke, some have alcohol. All these things cause infertility, and the rate of infertility has increased a lot. So be grateful that you are have been chosen to become a mother. Then don't take it as a burden, because it might be difficult, but always worth it. And please don't compare. There should be no comparisons that when this lady was pregnant, when I was, usually the mother-in-laws or the mother might tell you that when I was pregnant, I used to do this, I used to do that, I never had this, never did this. So I think there should not be any comparisons. Each experience is unique. When you're pregnant, some patients in their first pregnancy have many complaints that we have fatigue, we have vomiting, and in the next pregnancy, when they become pregnant again, they don't have vomiting. So they are sometimes very anxious that is it normal? Why I'm not having vomiting and all that. So there are no comparisons. Each experience is unique. And finally, enjoy the journey. Don't be so focused on the destination that you forget to enjoy the journey. To enjoy the journey as much as the destination, the whole process of pregnancy, enjoy it, because once or twice in a lifetime, you're going to get this opportunity. So finally, now the last slide, motherhood is messy and challenging and crazy and sleepless and giving and unbelievably beautiful. So this is me with my two angels, and I have a daughter who's 5 months old. So I think I am right now facing the same things, like the challenges I'm facing, and every day I'm dealing with different challenges and finding my own solutions. Thanks a lot.
Wow, thank you so much, Dr. Ami. I think I wish I could have met you or heard your session just 4 or 5 years back, so I could have benefited more. But then, thank you so much
Thank
for
you.
this wonderful session. We do have a set of questions for you that has been gathered through the survey. So, can I ask the first one?
Yes,
Yeah.
yes.
So, what are the best ways to avoid gestational diabetes? Is gestational diabetes hereditary while I'm pregnant?
Yes. So gestational diabetes can be hereditary, and sometimes even if you do not have a history, there you might develop it. So the first thing is when you meet a doctor, they will advise you um, OGTT, which is an oral glucose tolerance test, or a fasting blood sugar and post meal blood sugar. So if they are in the normal range, then you do not have that gestational diabetes, and it is hereditary. If your mother or father are diabetic, there is a high chance that you may develop diabetes during pregnancy, because pregnancy itself is a diabetogenic state. So we must understand this, that and gestational diabetes later on after delivery, you might become normal. Matlab the sugars might become normal, and sometimes you can also develop diabetes type 2 after pregnancy. So yes,
Okay.
it's
Okay.
hereditary, and you can avoid it by decreasing the excess sugar in your diet and excess carbohydrate in your diet, and regularly testing yourself for sugars during pregnancy.
Sure. Awesome. Sure. The next question is, I am 40 years old and still unmarried. I was told about freezing my eggs. Can I do it? What side effects are there due to freezing the eggs?
Okay, so now this question is very tricky. See, when a woman is born, what is the difference between a male and a female? When a woman is born, she is born with a set of eggs in her ovary. Okay, there are around, suppose, 1 million eggs in both the ovaries. And as she grows, these eggs start getting destroyed on their own. And when she attains puberty, she starts ovulating. But every time she ovulates, there are around, I don't know, I mean, 1,000 eggs which might get destroyed, like with every cycle, and one ovum is released. So, like that, the woman is going to ovulate for around 400 times in her life. And then she attains menopause. That is, all the eggs in her ovary are over.
Mm-hmm.
So, when a woman ages, she's born with only a set of eggs, which at the end are going to get destroyed at the end, and she attains menopause. And these eggs are going to age with time. She is not going to form new eggs. We need to understand that. So with age,
Sure.
her eggs are going to also age. So after 35, the quality of eggs is not going to be very good to become pregnant, and the baby might have multiple chromosomal abnormalities or structural defects, because the aging egg is not very fit to form an embryo. So the best time to actually store your eggs would be less than 30 years of age. That is the best
Okay.
time. If you see your
Hmm.
future that I'm not going to get married in future, or maybe I need to store my eggs, then the best time is less than 30 years. And even if you're late, then less than 35. At 40 years of age, I would not advise a woman uh, for storage. But still, there are few tests. There are certain blood tests, and on sonography we can test for the ovarian reserve of the woman, and if it permits, then she might store her eggs. But then again, the quality of the eggs is not going to be great
Sure, sure.
at
I
40 years.
think, yeah, you did answer one of the next question that I was supposed to ask was I'm 38 years old, so I'm planning to have a kid and have been married for now next almost 10 years. So is IVF safe? So
But the first question I would ask her, why does she want to have IVF? Like, she has met someone and someone has advised her IVF.
so
If
maybe the
somebody has advised
pregnancy is
her,
late. Pregnancy is
okay,
late,
so
so
maybe,
is
okay. See, without meeting the patient, actually, there's a lot of detailed history taking that goes
correct.
into every patient of infertility. So, on this question, IVF is safe if she is medically fit, she does not have any medical disorders, and there are multiple tests that she will have to undergo, and then it will be decided is her uterus proper. There are tests which like hysteroscopy. If somebody has heard that, we check the uterus from inside and the uterus from outside
Okay.
by laparoscopy, and we confirm that the uterus is fit to bear a pregnancy, and the quality of her oocytes and the quality of the sperms that we are going to use to form the embryo. All that has to be first checked, and then we tell the patient what are the chances of her becoming pregnant. And
Yeah.
along with that, very important that after she becomes pregnant, she undergoes the routine tests and also certain other higher sensitivity tests to know that the baby is good or not, because her age is 38, and definitely her partner's age will also be similar.
Yeah. All right. I know this has a lot of dimension, but thanks for answering that. Maybe in the interest of time, one last question is I have put a lot of weight after my second child, and I had both the C sections. What is the best way to reduce my weight and stay healthy?
uh, Hello, can you hear me? I think
Yes, please.
Yes.
so uh, see,
Immediately
gaining weight
बंद करना
during pregnancy is very natural. Usually, the woman gains
गाड़ी को
around
बात करना
11 to
बच्ची
15
अनम्यूट
kg of weight, which is the general weight gain. And post delivery, after cesarean, the woman must use an abdominal binder belt to strengthen her abdominal muscles. And once her muscles are strengthened, then she can move ahead with doing abdominal exercises. Usually, it's recommended to be started after 4 to 5 months,
Okay.
so that the muscles and the stitches inside have recovered well. And then she can do the routine exercises like, just for weight loss, you can do cardio and yoga is very very good for postpartum weight loss. And one needs to understand that this weight loss weight gain that has happened during pregnancy has happened over 9 months. So the weight loss is also going to take time, and we should not be too aggressive on ourselves,
Yep.
because we have to look after 2 kids and then take care of our health. So I think routine cardio like Zumba can help, and yoga can help. But don't take a lot of stress, because see, you are going to reduce weight over time. Even if you take 2 years, there is no problem, because see, if you're an actress or something, so theek hai, then you have to invest in that. But if you're not, then you can take it easy. Don't take a lot of mental stress. Yeah, nahi to it just spoils the whole fun.
Absolutely. Yeah. All right. So thank you very much, Dr. Amy, for such an amazing session. I think it gives a lot of confidence
Thank you
for
so
us
much.
to take all these knowledge and insights from all our esteemed panel today to spread it to the world. So thank you very much. And Kalyani and Anupama, thanks a lot for this opportunity as well. So back to you, Kalyani, for taking the session forward.
Thank you, Dr. Ami. This has been really informative. And the questions asked, I had to
Thank you.
filter out of literally around 30 to 40 questions and choose. trust me, I was like, which is important, which is not important. I was racking my brains off, and I just picked up. And definitely, I'm hoping that we'll have more questions. I will share it with you. Probably you can answer eventually. And this definitely is informative, and I'm sure a lot of our viewers who are going to view at the later point of time also will feel it is absolutely informative. Thank you so much, ma'am. So over to Nirja, who is going to introduce our next panelist.
Thank you, Kalyani, and thank you, Dr. Rami, for that informative session. Uh, may I now welcome on behalf of G100 Dr. Soumya. Dr. Soumya, are you there? Can you please turn on your camera?
Yes, am I audible?
Yes, doctor. Thank you very much.
Yes.
Welcome, Dr. Soumya, and a very warm welcome on behalf of G100 from all of us here. So I take this privilege to introduce Dr. Soumya. Dr. Soumya is a consultant in the Department of Internal Medicine working with Continental Hospitals, Hyderabad. She has attended various conferences such as the 68th Annual Conference of the Association of Physicians of India and 40th Annual Conference of AP Chapter of API 2012 and also the Conference on Medical Statistics 2014. Her CMAs include the Mamata Medicon and Dr. NTR University Health Sciences Zonal CMA in the month of December 2011. She has also had a workshop on pharmacovigilance in the year August 2012 and many others. So one of the achievements I would like to share with you all about Dr. Soumya is she was awarded the All India Best Thesis Award at API CON Epicon 2016 Hyderabad. So very warm welcome to you, Dr. Soumya, and we are privileged to have you here in this session. Over to you, Dr. Soumya.
Thank you, Mrs. Nirja, and thank you everyone, first G100, for giving me this opportunity. And it's so lovely to see all women on the screen, and hopefully to see all of you offline and meet all you beautiful women once for such lovely interaction. Yes, so coming to the topic that I would be speaking now about menstrual hygiene, menstrual cycles, postmenopausal health. So, as a physician, what we generally encounter or we advise is first is education. So, menstrual cycles and educating young kids about menstrual hygiene is very important. And when we talk about educating young kids, it is not only the girls that we educate. It is very important to educate our boys also on the menstrual cycles, about what happens during menstrual cycles. And it is not a taboo to undergo these menstrual cycles. And educating the kids of what is going to happen, and educating the girls more precisely that this is not a sickness, this is not an illness. We go through a beautiful thing, beautiful period of ovulation, and it is the most fertile period. So from the menarche to the menopause, we consider it as a fertile period. So you need to educate these girls that first thing, it is not a taboo, it is not a sickness. You're going to go through the most fertile period. Your body is going to undergo a lot of changes, and these changes will be adaptive, should be adaptive, and have to follow strict hygienic protocols whenever we are in menstrual cycles. The reason why we are talking about menstrual hygiene over here is because first thing, during the menstrual cycles, the first cycle or second cycle could be very strenuous to the girl child. So they do not know how to, we call it as collection of blood. So like we can use pads or tampons or menstrual cups or anything. So how to use them, or educating these young girls about how to use them, how to dispose this collected blood, like how to clean their menstrual cups, or how to dispose the tampon, or how to dispose these pads. Third, during dispose, how to dispose them only in the garbage, not into the toilet, not to flush them, how to wash their hands, clean their hands after changing of pads. Fourth, the cramps that they're going to experience, or the pain, that physical pain that they're going to experience during these menstrual cycles. So these are the four things that we generally educate the young kids about. So As a physician, when I come and talk about menstrual cycles, or when I see young women, let it be during pregnancy, premenopausal, or during their menstrual cycles or menarche, the first thing that comes to our mind is anemia. The numbers are quite surprising of how many people do not, address their huge blood loss or their anemia, or what is required to correct this anemia. So generally, in what kind of sector we see is heavy menstrual cycles due to any reason. They lose a lot of blood, like somebody who's changing 5 to 6 pads or more than 6 to 7 pads a day, losing a lot of blood, not having proper diet to correct or regain this lost blood. This is where the physician role comes into play. So how do we do? So we advise them on diet, we advise them on oral supplements, or somebody who's severely anemic, we advise them for IV correction of, first correction knowing the reason, second correction of anemia either through injections or oral form or the dietary form. Second, when using these menstrual pads, see, there are a lot of things like cotton pads, absorbable, biodegradable, a lot of things. But proper, even the timing of change of pads is very important. Otherwise, if they do not change these pads for a very long time, due to this dampness, they are more prone for fungal infections. So when I talk about menarche, the main concept that I want to talk over here is even the routine breast examination, which most of the women forget or most of the women do not do. So self breast examination once in a month is mandatory. So how do you do a general breast examination is we use the palm. So the flat surface of the palm in a rotatory motion on your breast is very important. So you keep rotating on both the breast. You do not, even over the nipple area, even over the areola. So what happens? So when you rotate, and if you see or if you feel any lump to the palm or to the fingers, you try to hold that lump. Any lump, if you feel, you have to report to the nearest physician or to your family physician immediately. So is it only the lump that we are worried about? It is not just the breast in the lump, but breast even in your underarm also that we are worried about. Or any abnormal blood discharge from the nipple or any discharge from the nipple or any painful breast areas, any wrinkles or any skin changes over the breast areas, we are more concerned. And any of these sort should be shown to the physician. So that comes about the menstrual hygiene and menstrual cycles. Though because I'm a physician, I'm limiting my talk because gynec and all the previous speakers have spoken about a lot of things. But a very simple thing that prevention is better than cure. So there are two things. One is regular pap smear, regular mammogram to women, and HPV vaccine. So human papilloma virus vaccine for the prevention of cervical cancer. Second, regular mammograms for those who have a family history or who don't have a family history also. All those who have a family history of breast cancers, we advise early mammograms from an early age. Otherwise, we generally use mammograms as a screening method for somebody above 40 years. Somebody who is less than 40 years and still are suspicious of a lump or want to get a routine breast examination done can undergo ultrasound breast. So, and coming to HPV vaccine, so depending on the schedule, we advise for generally most efficacious for somebody who's less than 26 years. 26 to 45 years also, we do advise for the vaccine, but the efficacy of the vaccine will keep coming down as you age. So these three things. So pap smear, yearly mammogram, and young adults. So young adults, we advise for human papillomavirus vaccine. Very surprising that even in so much of education, so much of access to the technology, surprising that most of the women or most of people are not aware about HPV vaccine. We see a lot of women coming into the hospital and we talk about HPV vaccine. They're all puzzled. They surely have a question mark on the face about what we are talking. So it is very surprising with so much of access to the technology, and most of these women are IT sector. So, they're on the screens 24/7 with 100% access to the technology, where there is lack of information of a preventive. So, any cervical cancer at stage 0 or anything positive on the pap smear, in the early stages is like curable, 100% preventable by a vaccine, but still they're not aware. So coming to the menopause, so somebody who's finished their periods or not getting their regular menstrual cycle or stopped their menstrual cycles, we call it as menopause. So during menopause or post menopause, so what happens to the women health after menopause? So a few things that we are concerned post menopause. So when a old, somebody above 60 years or an elderly woman walks into the cabin, first thing that we are worried or first thing that we ask is the awareness on osteoporosis. So yes, I can see around 29, 30 people. Can any one of you raise hands of who knows what is osteoporosis and what can be done? Only one among 30. Okay, see, this is not a surprising answer or surprising number to me at all, because yes, when I say osteoporosis, they say what is it and what we have to do. So what happens during the menopause is that because of the hormonal deficiencies or hormonal alterations, the strength of the bone is decreased. So there is a calcium deficiency or calcium loss from the bones. So what happens? So whenever there is no calcium in the bones, the strength of the bone is gone. So what happens when the strength of the bone is gone? So they cannot hold your weight. They cannot hold minor injuries also. So you must have heard, like, in your neighborhood or somewhere, that there was no injury at all, just a trivial, even while walking down the stairs they broke their leg, or they lost the height. Somebody who was 5'6" before menopause, and post menopause they've been only 5'2", 5'3", and they are bent forward, or all these is because of osteoporosis. And osteoporosis is preventable. How do we do? So there is a simple scan called as BMD. It is nothing but a bone density scan that we do. So we generally do it around the spine and around the hip region. So when when there is a decrease in the bone density, we give medication to prevent the loss of calcium from the bones. There are a lot of treatment options. So mainly we first start with them on calcium supplements. So somebody who's attaining a menopause have to keep themselves on calcium supplements. So all those who say that the calcium supplements can cause a lot of side effects, I had kidney stones or some XYZ complication. For somebody who is not keen on having a calcium supplement, I would say at least calcium rich diet, like sesame seeds or milk, something which is dense in calcium, can keep having. So you start on calcium, you break it, you don't want to take it after 3 months, you break it down for a month, have milk or have calcium rich diet, and then get back onto calcium. Despite having calcium, your bones are showing osteopenia or osteoporosis, then what do you do? So we have a lot of treatment options so you can see the nearest physician. So second thing with postmenopausal women, yes, most of them, or the most commonest thing what we hear, hot flashes and night sweats. So these are all because of the hot flushes can be very frequent, like in once in 15 minutes to once in an hour or once in 2 hours. So somebody who's not able to take the hot flushes and everything, we ask for a hormone replacement therapy, or even before the hormone replacement therapy, like some cotton clothes or breezy clothes, to avoid these hot flushes or to avoid taking. So these night sweats can cause disturbed sleep, and sometimes a lot of patients that we see with depression issues because of various reasons. So third thing what we see is vaginal dryness. So vaginal dryness can lead to decreased sexual activity or painful sexual activity, and the vaginal dryness can be an indirect reason or indirect cause for urinary tract infections. So we make sure that their personal hygiene is at utmost priority. So somebody who's having a recurrent urinary tract infection, we evaluate them for vaginal dryness also. So anybody with recurrent UTI or anything like any signs of urinary incontinence, we educate them about Kegel exercises. So what exactly are these Kegel exercises in urinary incontinence? So we tell them a couple of exercises like holding of urine during the midstream for a couple of seconds. So these are all pelvic floor exercises to tighten up the pelvic muscles to avoid or decrease the incidence of urinary incontinence. So the other thing post-menopausal we see is cholesterol issues. So because of the hormonal imbalance and everything, they may have cholesterol issues, which make them more prone or more incidence of strokes or heart attacks or anything related to high cholesterol issues. Then coming to, yes, sparse hair or hair loss or dryness of the skin or wrinkled skin or loss of fat under the skin, all these are also the changes of postmenopause. So my take home message from this would be educating kids at a very young age, regular breast examination, regular mammogram, regular pap smear, HPV vaccine, osteoporosis prevention, calcium supplementation in postmenopausal women, prevention of recurrent urinary tract inflammation, recurrent urinary tract infection because of vaginal dryness, and that last thing, but not very important, regular physical activity. Somebody who's at 55 or 60, postmenopausal, they take it as an leverage to stop their physical activity, which should 100% be avoided. You can be physically active. We have women of 75 years who walk into the cabin and say, my son doesn't want me to work anymore because he feels I'm too old and, to work so hard, and they want me to be at home. No, we encourage women till whatever age they want, till whatever age they feel like working, to be physically active, to go for their own work, to do their own work. There is no age limitation for doing a physical activity. Till the time you can do, please go ahead with your physical activities. Physical activities do prevent depression, do prevent cholesterol issues, do prevent heart attacks and strokes. So physical activity is a must. It is nowhere related to the age of the person. Yes. Thank you so much for giving me this opportunity. I'm just keeping it very short and crisp. So just addressing the major issues of what we can. And yes, the other thing that I forgot to add is your vitamin D supplements in the post-menopause, because vitamin D is very essential for the absorption of calcium. So just calcium wouldn't help. So calcium, magnesium, vitamin D, all these are very necessary for the bone health.
Wonderful.
Yes, open to you all for the questionnaire.
Thank you, Dr. Soumya. You touched upon a very important topic, because I keep arguing with my mom saying you're supposed to take rest and you keep overexerting yourself and you want to take control of everything. And I keep pulling her leg, I keep irritating her. And it's really informative for me. I think from now on, I'll refrain from doing and encourage her to do what she has to do. Thank you
Yes,
so
very
much.
important. See, the mental health of women at an older age is very important. It's very important for them to go out, socialize, talk about their problems, talk about their happiness. As important as it is for young women, it is even important for old women. It's not because they're just old, they're restricted to their room or their house. Go out, walk in the sun, talk to your friends. It's not like it's like an end of era. Okay, the menstrual cycles are done, so my life is also done. Nothing like that. It's very important that they talk to each other, about the problems that they face, because they say, what comfort a friend or a near and dear one can give, no one else can give.
Very true, very true. Thank you so much, Doctor. It's informative. Over to Nirja. Nirja, probably you may want to take up the questionnaire.
Yeah, sure. Thank you, Dr. Soumya, for that amazing and fantastic information shared with all of us. And we have a question here from one of the participants. Ms. Lalita says, does the age at which menopause sets in have a relation with general health? Can you take this question, Dr. Soumya, please?
Yes, so there are there are two types of menopause. One is the physiological menopause, which is attained around at 55, 60 years of age. So early menopause is someone who's attained their menopause less than 40 years. So early menopause is becoming very common these days because of the lifestyle, because of the stress. So, and even family also. So somebody who has a strong family history of early menopause are prone for, having an early menopause. Somebody whose lifestyle is bad, like, history of smoking or no physical activity or stressful life, can have an early menopause. Third is what is called as surgical menopause. So for any reason that, they get their uterus removed, we call it as a hysterectomy. So somebody who's got a hysterectomy done, so they attain their menopause very early. So obviously when they're returning their menopause very early, the risk of all these are also, comes as a package with the menopause. So the calcium deficiencies and they deal with more of mental. They need a lot of mental support than somebody who's attained a physiological menopause at 60. So somebody who's finishing their sexual life at 40, or who doesn't have a sexual desire, or who's having a painful sexual life at 40, surely needs more of mental support. Second, and the bone strength also comes down. See, let it be a surgical, let it be a early menopause or whatever. The hormones are getting imbalanced. So the bone health, starts deteriorating at a very early age. So the well-being is, yes, obviously disturbed, and obviously more when you have an early menopause.
Thank you for that, Dr. Soumya. So may I go ahead with the set of questions that we have gathered from the Google form that we shared across. So the first one would be what to do while suffering from PCOD, and what diet is to be followed in case of PCOD or PCOS having irregular period because of that.
So PCOD or PCOS is like having polycystic ovarian syndrome. So PCOS, obesity go hand in hand. So obesity can be one of the leading cause for PCOS, and somebody who's having PCOS experience obesity or experience reluctant weight loss. Like they find it very difficult to lose weight. So they go hand in hand. So what we generally tell is diets which can help them in losing weight. So either a calorie deficit diet. So we have something called as low calorie diet, very low calorie diet. So someone who can count on the calories to lose weight. Second is because of PCOS, a lot of people have insulin resistance. So for this insulin resistance, we ask them to have low glycemic index foods. Low glycemic index foods can be like low carbohydrate, more fiber, and more protein. So when we are talking about PCOS, there are two things: for weight loss and for insulin resistance. Weight loss, low calorie diet, and for insulin resistance, it is going to be a low glycemic index foods. And coming to physical activity, we talk about 30 to 40 minutes of cardio, at least for 4 to 5 days in a week. A good cardio. We do not accept any household work, because a lot of women say, okay, I've done my household work since morning. The household chores have been taken care of me, so that this is the physical activity that I do. No, this household chores or anything is considered, you used to it since childhood, so we do not consider that as a physical activity.
Thank you. Yes. As rightly said by Dr. Soumya, there are many ladies who feel that the household chores is enough and they do not need any other physical activity. Okay, going ahead with the next question, Doctor. Why is it difficult to establish difference between PCOD, PCOS, and infertility?
See, the one of the leading cause for infertility can be PCOD, because generally there is an ovarian failure, or generally there is generally there is obesity in PCOD. So obesity itself is one of the causes for so infertility, and PCOD is one of the main cause for infertility. So why is it getting difficult? Because all these what we are talking about, all of them go hand in hand. So if we say you want to get pregnant, you treat your PCOD. For if you want to treat your PCOD, your insulin resistance has to come down. For all this to come down, your weight has to come down. Your lifestyle has to change. So everything, when everything goes balanced, you attain what you need. So it's not like some other illness where okay, we give one medicine and it's gone. It needs very strict lifestyle changes to control PCOS and PCOD, which is the main cause of infertility. But I cannot say PCOS can cause infertility, but yes, majority of patients do have infertility or difficulty in attaining pregnancy because of difference in ovulation. So sometimes it's delayed, sometimes it's early. The cycles are altered. The cycles are unpredictable. So when the cycles are unpredictable, obviously the ovulation period for us to calculate is unpredictable. So that makes it more difficult to attain the pregnancy.
May I go ahead with the next question, Dr. Soumya? So
Yes,
here
please.
we have, I have a fungal infection in between my thighs. Please share remedies for the fungal infection.
So fungal infections, see, there are a lot of fungal infections, skin infections. What we generally tell when there's somebody with a fungal infection, especially in the thigh region or close to the vaginal area or anything like this. So we Tell them to keep the area dry, to avoid to avoid sweat, or to avoid synthetic clothes, or to wear natural cotton, breathable or absorbable clothes. First thing. Second thing, fungal infection. The main thing that we are worried about fungal infection is resistant to medication and recurrence of fungal infection. So to prevent this, first thing I would say is make sure you use the antifungal treatment in a complete course. Listen to the physician. Just don't stop it because you do not see the fungal infection, or you see that the fungal infection on the skin has disappeared. So stick to the physician's order. Second, wear your breathable clothes, cotton clothes. During the menstrual cycle, make sure you're using cotton pads, you're changing it frequently, and you're cleaning yourself properly. That is personal hygiene.
Yeah, thank you. And going on with the next question. So, this is something very sensitive question. Is sexual intimacy during periods attributing factor to vaginal infections or UTI? Could it attribute to critical illnesses or lead to any disease in future?
Okay. See, when sexual activity during menstrual cycles, see, it is their personal call. The only thing that we are worried about, the exposure of, the partner to the blood content. So we are more worried about sexually transmittable diseases. Sexually transmittable diseases like HIV or hepatitis B or any other thing where we are worried about sexually transmittable diseases. Coming to urinary tract infections, there are a lot of reasons for urinary tract infections or vaginal infections. See, unsafe sexual practices during menstrual cycles or apart from menstrual cycles are hazardous and can cause infections first thing. So let it be during the menstrual cycle, you need to practice safe sexual practices. And if you're having a sexual intercourse or sexual participation during the menstrual cycle, it can be, we see a lot of things like, somebody who's been very sensitive and, see so much of blood content when they're having a sexual activity, can have discomfort. First thing. Second thing, it could be, see, it is clearly like, cleaning process or hygienic methods that they need to follow during the sexual practice. So these two things. And third is the STDs, sexually transmittable disease.
Yeah, last but not the least, question to you, Dr. Soumya. So, I think this was answered by Dr. Shaila also earlier. How do you deal with hormonal changes during periods? Any exercises that may be helpful?
So during menstrual cycle, hormonal changes are, there are hormonal changes. That is why we experience abdominal pain, abdominal cramps. There are a few people who come to us with nausea, vomiting sensation, loose motion. So these all are experienced because of the menstrual cycles and the hormonal changes during menstrual cycles. The kind of physical activity that we advise is very lightweighted, minimal cardio or moderate cardio, and no excessive cardios, no excessive weights are advised during the menstrual cycles.
Okay, I think we have a question from one of the participants, Ms. Nishita. I'm experiencing painful lumps in the right armpit which appear and disappear on and off. Do I need to see a doctor? Can you
Any
please?
lump, any lump in the breast and in the armpits have to be addressed. Let it be even a non-cancerous, let it be even a benign lump. Yes, showing to your physician is very, very important. And experiencing lump-like feeling in the breast tissues or in the armpits during during ovulation period or before or after, right before or right after your menstrual cycles can be common, but still a lump needs to be addressed by a physician.
One more question, doctor. How to get rid of vaginal smell naturally without medicines or any fancy washes like we wash?
First thing is personal hygiene. Keep yourself clean and dry. These two things are very important. We generally do not advise any fancy washes or over-the-counter medication for cleaning vaginal area because they can contain chemicals. They can cause you rash or vaginal irritation. So we do not advise any over-the-counter medication. Somebody who's having a vaginal smell, that could be because of bacterial infections. So showing to your physician is important. Second, keeping your vaginal dry, vagina clean is also important to get rid of these smells. And fancy washes are surely to be avoided without a medical prescription.
Thank you, Dr. Soumya, for this fantastic and interactive session. A lot of information, a lot of knowledge for us. And that's it from my side. Thank you once again from on behalf of G100 for your valuable time and joining us. Thank you.
Thank you.
Thank
Thank
you.
you so
Thank you,
much
Dr.
for
Soumya.
having me on the session. It was lovely to see all you ladies. It will be a real pleasure to meet all of you in the real world, then not the screens.
Thank you. Thank you so much, Dr. Soumya. And especially appreciate that you accepted on short notice. Thank you millions of tons for that.
Thank you. Thank you so much for having me.
Thank you. Over to Anu. Anu, you may want to introduce our next speaker.
Yes. So our next speaker for the day is Dr. Shaila Patel, and it gives me pleasure to introduce her. She is a practicing gynecologist and obstetrician with more than 40 years of experience. Not only is she a highly experienced and a wonderful doctor, and here I'm speaking from personal experience, but she also is a wonderful, wonderful human being. From past 8 years, she is closely involved with the overall hygiene of women, working extensively with menopausal women and welfare of children with special needs. Having participated in numerous conferences, symposiums, and extensive initiative with NGOs, doing projects and engaging in gynec issues. Now, here we are fortunate to have her join us today to share her thoughts and mentor us through this process. Friends, please join me in welcoming Dr. Shaila Patel.
Thank you so much, Anu. It's been pleasure having here and listening to the people with their different views. Can you hear me?
Yes, ma'am.
Yes.
Yeah. I think we have had a very long session. We are overdoing in the time. If you want me to talk about menopause, I can make it very short because on Dr. Soumya has touched most of the points. So if you want me to still say something or have a question answered, I'm willing to do anything that way. So that
Ma'am,
will
please
show.
go ahead. Please go ahead with the session and please we'll take up the question answers after you.
Okay, now
Give us a
as
brief about it.
Okay. You have given me a topic of menopause. Now, I think menopause has become a hype thing because everybody talks about it, everybody feels about it, and I feel that I have worked even in England for 10, 15 years. That time they were talking about menopause, everybody was getting panicky, and it has migrated to India because we all travel a lot. Think about our mothers, our grandmothers, our mother-in-laws. Probably they didn't have time to think about this menopause. They didn't have much time, or they have so much of social support, staying in a joint family, that those minor things were being ignored, and they never thought that this is something different. This is something we have to look for it. We have something to go to the doctor. Maybe now husbands are also aware that they bring the patients, that having a single family, there is not much of a mental support anyway. Menopause starts from 45 to 55. It may be having 1 or 2 years plus or 1 or 2 years minus. And if your mother or your sister or your granny has it, during that period of time you are supposed to get it. But again, your lifestyle is different. Than even two sisters lifestyle is very different. If you are a smoker, if you are an alcoholic, then the whole scenario changes. If you live in a mountain area, then menopause comes a little early. I would say 1 year of no menstruation, I would label it as menopause. But under 40, I think only 1 or 2 percentages are having menopause because it has to be related with the menstruation. Alone having mental problem, find out if there is something wrong with the lady or the family setup or the people surrounding her. In menopause, the menstruation is not regular, may be regular, irregular, in between spotting, and all this can be diagnosed by ultrasound, by blood report. And I personally feel that in menopausal women, once they stop or having a very low estrogen, their calcium deposits or the vitamin D deposit starts going down. So we can have the blood reports also. We can get the ultrasound done. We can get the other all few things done. But mostly now I have seen that women come with the mental problem more than the physical problem. The irritability, depression, mood swing, sweating, hot flushes, cold sweats, losing the libido. The husband comes, said that she's too dry, we can't have the sex properly. Okay, some areas we can help them by medicine, but irritability, mood swings. I think I run menopausal clinic of 15 women, 15 couple. And now they are so happy because I have introduced yoga into them, meditation, breathing. We are all forgetting our small, small things which are available in India, which India is very good at it. All of us are going for the medicine. Why are we not looking into other factors also of a woman where she cannot say much or she has become very aggressive? The family support is important. The husband support is very important. I think these days we are all forgetting it. We have no time for all that and we just prescribe them medicine. ये ले लो अच्छा ही हो जाएगा आपको. Again she comes back after a few months and she said, Doctor, I am not still well. So I think we have to look into a lot of other matters and we have to teach the person who comes to us, give them a little time, talk to them with lot of love and see that all these problems are solved because one problem leads to another one leads to another one. And it is the menopause where a woman cannot keep her probably mind steady, probably she gets angry, probably she has mood swing, the whole family gets disturbed. And I feel that those are the little important thing. If she has a dry vagina, there are creams available, there are estrogen creams available, lot of creams are available. We can educate the husband, can wait for a little while, let the medicine act, then see how you feel about it. Maybe there is a lot of problem between husband and wife and she has totally gone off sex. Again, we are attributing it to the menopause. It may not be menopause related. There are quite a few things which are not menopause related. So I don't know, maybe I'm an old timer. I look into the family, I like look into the matter. I don't straight away give them advice. I call the family, I call the husband, I run the menopausal clinic. It's very easy to say, do this, do that. But are we really looking into the matter and trying to solve their problem? Medically, we can give them medicine. We can give them calcium. We can get their basal metabolic rate done. We can do a lot of things. But I'm more worried about the mental status of the ladies. Where in India, they have to really shout to be listened to. I wish the old joint family where mother-in-laws are loving, the husband is loving, that old joint family comes back and we can not solve the problem, but we can help them even a little bit here and there. This is, I really wanted to say, and I have nothing much to say because all the people who have come here, they can go through the Google, they can go through that, they can get the thing. I have patients who come with the Google note and say that, explain to us what this is. So this is not an educative program. This is a solving problem. If we can all solve what is to be done, I think then this is the meaning of the whole scenario. Educating people, they get educated. They know so much more than I think we think they know. So this is not an educative program. This is how to solve their problem is a problem. This is what I
Wonderful.
think, Kalyani.
Yes, ma'am. Wonderful. You've actually touched on the topic that is family supporting during menopause is very important, because I, as a counselor, I come across so many women who come back and say they have whole lot of issues because they are going through menopause, and there is nobody to support them. Also, because this is happening, there are a whole lot of reels and videos being made as per the current requirement. But solution for that is not arrived. Only the problem is projected the solution. I think we have to collectively educate that this is not a big problem. This can be solvable
First
problem.
of all, we have to stop hyping the menopause. We have to just say
Yes,
that this is one of the phases. All women go through it. Your mother did, your grandmother did, probably you will do, your daughter will do. Every life has a phase. So this is a
yes,
phase. That is nothing much to worry about. So first of all, giving assurance to them, I think it's a very important thing. Sending them to a psychologist, go to a psychologist, go to talk to them. I think that's not going to help them.
right,
In
right.
olden times, not even olden time, about 10, 15 years back, there were families who could look after each other. Aunt will look after. Suppose a mother has gone little wonky, somebody will look after the whole scenario. Now the single family, the freedom, that has all spoiled the mental attitude of the women and the men
True,
too. So husbands have to be called. We have to educate them in a very simple words. You don't have to spend hours and hours to doing that. Even 5 minutes is good enough, but at least she should feel that somebody has taken little interest in her. Showing
true,
her here
true.
and there doesn't help her at all. I feel that.
Makes sense, ma'am. Ma'am, we have a very important question from Anupama. She says, I went for an early menopause before 40 due to a surgery of ovarian cyst. But now I have started to experience hot flushes. I'm turning 59 in 2 months. Is it normal?
No, at 59 it's not so normal. So if I were having a hot flashes or Anu is having that, I would advise her to go for long walks, drink plenty of water. I think she's going for long walk, that I know. The best thing I would advise her, not at 59, I would advise her to go for meditation and exercising and breathing exercises, which is very important. Now at this stage, I don't think I would prefer to give her medicine because it is all HRT. We are nothing more than HRT in our life. But some will play like that, some will play this way, some will play that way. But the medicine, I feel her age, it's not advisable. And I would not give her. I would advise
Great.
her to go for meditation, to go for yoga camps, to mix with other women. Not that
That's
it will
wonderful.
help her, but it should definitely help her. Breathing exercise
Wonderful.
are known to develop, known to sort of quieten down the hot flushes and cold sweats.
Wonderful. Wonderful.
Or
That's
at the most,
amazing.
you can decrease the temperature of your AC.
That's
No, at
really
this
great.
stage, I don't think I would advise you all that.
Okay.
Go for more
That's
Ayurvedic, go for your stress relieving, whatever you have. There are so many centers, you can afford it. Go for detoxification. So many things are available, except medicine, I would think.
Ma'am, that's really amazing that you are not supporting medicine, because present day anybody wants just a goli kha liya theek ho gaya. It's
Nahin,
not a
nahin,
thing.
nahin. I
Naturally, you
think it
should
is,
look.
no, I'm sorry, Kalyani, but it is we who have formed the habit. अरे ले लो
True.
यार, कुछ नहीं होगा. Because we don't want to spend good time with them. That is our
Right,
problem. We
right,
being
right.
doctors, we can say, "Can I, darling, do this, do that. See if you can get better. Otherwise, come back to me. We'll give you medicine." Medicine should be kept as the last option, I feel.
Wonderful,
Yeah.
ma'am. Wonderful. Ma'am, I'll ask the next question. Here, one of the sisters has asked, my mother had menopause at 47 years and her period stopped around 49 years. Same with my grandmother. I am 45 and the doctor says I am going through menopause. isn't menopause hereditary?
See, menopause are, I would divide them into two factors. First is mental and second is menstrual physical. Right? Now, once you are say 44, 45, your period would definitely start becoming irregular. You will have spotting in between, or you may not have period for a few months and again start it. So,
Right.
saying that you will undergo menopause, I would tell patient to get the ultrasound done. I would get the FSH done, because I would, if she's so much worried, I would try to prove it otherwise.
Right. Right.
And then what is a big deal if you are going to go for menopause? Why are we making it as a big deal? Second, yes, darling, if your mother has gone through, you will go through. Everybody goes through. If this is not an aging process, but it is a different stages of life. We can't use the age word now, but you can say, yeah, what is a big deal in 2 years here or there? Why aren't we not making it look like regular things?
Right.
It is our problem that we somehow or other we make it point that, oh, it's such a big thing. No, I would not do that. I would make her understand. Then no big deal in 2 years, beta, here or there. Try and see how you go about it.
Right. I'm sure she'll
This is
watch
what I
this and
feel.
she'll understand.
This is what I honestly feel.
I'm sure she'll watch this and she will understand. Thank you so much, ma'am. Ma'am, I'll take the next question. And here one sister says, I'm going through menopause and I feel terribly angry and I get the urge to destroy somebody or abuse somebody or fight with somebody. What should I do? Whereas my twin sister is also going through menopause and she keeps crying and feels depressed. What should she do?
See, if the destruction is has become your nature, then I would put her on HRT. Yes, because I don't want her to harm herself or harm somebody else. If your sister is crying, that is not okay. I would say that take this tablet, see how you feel, come back to me after few months or maybe 6 months or 3 months. But person having destructive nature, I would definitely take an account. I would give her medicine. At the same time, I would call her husband, I would call the children, I would see that what is the destruction happening in the house, how can we handle it together. She is going through this phase because of her hormonal imbalance, can we all help her? So along with medicine, help her out other way also.
Right. Wow. Thank you, ma'am. That's amazing. I think she will definitely watch this and she will ask me for your number. I'll take the liberty to share your number with her in that case.
Thank you. If I can be of any help to her, I would love to do that.
Wonderful, wonderful. Definitely,
I have
ma'am.
got 15 couple whom I run the menopausal clinic. And what I saw them when they came and what I see them now, they are so much together. They share with each other. They now, I should not be saying, but they said, we don't care now what happens around us. That is also a little arrogant, but that is something freedom they got it by talking to somebody. So talking is very, very important. And
That's
patiently
nice.
listening to them, like I've been listening to you people since it started, though we are running off time. So that is what one has to learn.
Thank you so much. Thank you so much. Thank you.
Nowadays, we don't get good listeners, we get good talkers. I
Very
can talk
true.
good. Listen to somebody, touch their heart. That is the main
Very true.
medicine.
Very
But this
true.
is a
Very
old timer medicine. I can talk about it because I practiced for a long time. If I were young,
That's
probably I don't.
Wonderful, ma'am. Love you, ma'am, for that. Ma'am, we have another question.
Yes.
What medication, diet, fitness regime should be followed during menopause?
See, there is no definite thing that this has to be done, this has to be done. We all, I think, I'm sure all the doctors agree that we use estrogen, we use this, we use that. We use lot of, I use lot of soya milk also. So it's not alone the medicine, but soya milk, good diet. So all these things have to be compiled. Alone the medicine probably will help, but go for little natural also. Fruits है,
Okay.
estrogen dependent fruits है, वो dependent food है. So lot of things, and now there are so many things available in Ayurveda. I have not tried with my patient because I am waiting for them to say, okay, these are the trials we have done. So I'm keeping a close eye on that. But Ayurveda, they are claiming that you give our medicine. Is it like hormone? It is plant-based, but you give our medicine and see what results you get. So I'm waiting for them to come back to me. Otherwise, we
Wow.
can give estrogen, progesterone. Lot of medicines are available. That is not a single one. It is doctor's ring.
Wow.
If you read the report also, if you read the literature, there are 10 people saying 10 different things. So you pick up what you feel like.
Wow, that's wonderful, ma'am. That's wonderful. Ma'am, this is a specific question that I got from one of our sisters who's based abroad. She's not an Indian. She has asked me, can a woman conceive during menopause? Is it safe for her and for the baby?
Well, what age is she talking about? At what age?
She is approximately around 45 years, and she recently got married. So she's asking, can a woman who's going through menopause conceive?
Well, if she has not gone for menopause, if she is menstruating regularly, if she has other parameters normal, I'm sure IVF is the answer. But then if she then she has to get her husband also investigated for the normality, or
Okay.
her boyfriend. But I'm sure
Okay.
she can safely go for that.
Okay.
If she has no
Okay.
other problems, of course.
Okay. Okay.
My God, I would not dare having at 45. Ooh, never mind.
Ma'am, there's a question from Indo. She's asking, what is your secret for fitness?
What is my secret?
Yes.
Okay. Let me be very, very honest. I am a yoga freak woman. I walk for 5 kilometers yes, that is true. I walk for 5 kilometers a day. At 74, I play good golf. I'm not a
Wow.
champion, but I play good golf. So, in short, keep yourself occupied. Do some exercises. Do some good work to the community. God has given us so much that we don't deserve it. What my father told me, I still remember, and I try to follow him. He said, you cannot give anybody anything. What is your capacity? You are a trustee. So try and give 30% of what you earn. And that gives that mental satisfaction is very, very important.
Wonderful.
And
Wonderful. That's
everybody
well
doesn't
said.
have to dish out money. You can touch somebody with the love. You can talk nicely to somebody. It doesn't have to be money, money, money. So this is
Very
what
true.
I feel.
Wonderful, ma'am. This amazing is learning. I
No, no,
love you
no. I
loads
think
for that, ma'am.
Kalyani, you have learned to praise women, people. I
No,
think you have
I'm
got a
not
good art.
praising.
You have got a
Just
very
like
good
that.
art of praising people. Am I right, Indu?
She's always very kind. Anytime, she's
It's
very
a very
kind.
good quality to have. We Indians don't want to compliment people. We keep it to ourselves. Somebody looking good, you should learn to say, yeah, you look good. But not to somebody not looking good, and that is a wrong thing. So Kalyani, you got that gift from somewhere.
Thank you so much, ma'am.
Am
I
I
only
right,
speak my heart out.
Anupama? Am I right? What I told Kalyani?
Absolutely, absolutely. She's somebody who's kind of a powerhouse,
See?
a huge inspiration for all of us. I mean, you can't imagine the kind of effort she has done single-handed to put things together, the
Congrats.
emails, agenda,
Congratulations to you, Kalyani.
reflection. I mean, she's done everything. Today, though, we are just sitting relaxed because of her. She's managed
No,
everything.
I want to
And
No,
differ. It
and
is
see,
because of you
Kalyani,
guys this is happening. It's because of
no,
you people this is happening, not me.
it is your inner self. It has to be inner self, Kalyani. You cannot put on act. Act doesn't long for a long time. You have to be
No.
genuine.
And Dr. Shaila, unbelievable temperament. You will only see
No,
smiling
no,
like
no.
this.
Anu, sorry. Anu, sorry, I don't believe that.
I'm
Sorry,
telling
Anu, I have known you for how long now? You are one of the softest and a very courteous woman. You don't know that. I have known you
Yes,
for 20 years now. Or
bang on,
maybe
ma'am. Bang on. You
I think
said
27
all
it,
the
years.
ma'am.
panelists are very good and they need a good applause. Yes, thank you. Anything else you want me to say?
Ma'am,
Kalyani?
wonderful, wonderful, ma'am. Thank you so much for being a part of the session, and you made it really lively. And we had quite a bit of discussion, and definitely we did argue here and there. It is really amazing to argue on the session like this. Thank you so much, ma'am. And this session has been really amazing. I know we have overshot our time, but it's okay. This is our
No, that's
general
it.
trend. We follow that. We have not broken our record. What do you say, Anu?
Thank you so much. Okay.
Thank
Thank you,
you
Shaila.
so much, ma'am.
I'm not the person who can talk for a long time. I'm very short and very precise.
She
Oh, wow.
is, is she will not
Thank
mince
you.
a word. She say the way it is.
Thank
Wonderful,
you so much.
wonderful. Thank you so much, ma'am. Thank you.
नीरज जी आपको कुछ नहीं बोलने का है अभी मेरे में नीरजा आई एम टॉकिंग टू यू
Sorry, ma'am. Yes, ma'am. It was. I was
you
just.
know you have been looking at the watch somewhere you have a watch and you
No,
look at
no,
them
no,
and
no,
then come back to
no,
us.
ma'am. Actually, I have joined meeting elsewhere also. So I was looking into. I have three devices in front of me. One is this one, another laptop beside me, and on the phone also. So simultaneously, I'm attending so many meetings. That's why I was looking here and there. I
Okay,
was.
okay.
I was not looking at
Anyway,
the watch at
nice
all.
meeting you everybody. Thank you so much for having me. Thank you.
Thank you.
Thank
Thank
you,
you, Dr.
Dr. Shaila,
Shaila.
ma'am. Thank you to
thank
all
Thank
the
you.
you, ma'am.
esteemed
Thank you.
doctors. Yeah.
Thank you,
Yes.
ma'am.
Now, may I request Shubhashri to take over and introduce our next speaker?
Yeah, hello everyone. Good evening. Actually, I don't know, there is some problem with my laptop. I'm unable to switch on my camera. I just want to say one thing. I like the voice of Anupama ma'am a lot. It's very sweet. I'm hearing her for the first time, but whenever
Thank
she is speaking, it seems like she's singing. I mean, you really have a very sweet voice.
Thank you.
Wow.
And yeah,
That's
and
nice.
all the doctors, like whatever they have spoken till now, it was really, I mean, lot to learn. And definitely, we should all start exercising if we aren't. That is what would be my takeaway from the session. So yeah, going forward, I'd like to introduce our next speaker. Mrs. Anita Kali is an experienced officer with a demonstrated history of working in the government administration industry. She is skilled in project management, strategic planning, and ASCM. And Mrs. Anita has a rich experience of empowering communities at the grassroots level and assisting the patients of TB and leprosy in the rural villages of Maharashtra. So yeah, to you, ma'am.
Mrs. Anita? Mrs. Anita, you there?
She's not on the call, I guess.
Yeah, I don't
Oh,
see her. I don't see her.
I think she's logged off because we have shot the time by at least half hour right now.
Yeah.
This is our record, Anu. We have not broken it.
Yeah.
So, anyways, I'll probably get the answers for the questions that the people have
Yeah.
asked her, and we can share it eventually. Well, I
Yeah.
think we'll have to put a hard stop here. Thank you, one and all who have joined for the session. Thank you for making it so interactive, so lively, and special thanks to all the doctors, the eminent doctors who addressed our questions very patiently, especially Dr. Sheila, who's been patiently waiting for over 2 hours to complete this. Thank you so much, ma'am, and thank you so much to one and all who've been present on the call. It's amazing. And Anu and Nirja, do you want to say something?
Yes, it
Thank
was such an yeah, a lot of information we got from all the eminent doctors, and I really hope we carry on this message and the information as we as the representatives of G100 to wherever we spread the awareness and the message in the right way. And I think we need more people to join in such sessions. There was so much of information given by each and every doctor here, which is something a part of the I mean, every female has to undergo these things, and every female has to know about herself properly, so that she can take care of her health and her menstrual cycle and hygiene and all that. So let's come up with many more such interactive sessions, and really a big handful of thanks, and for these doctors for sparing their valuable time with all of us. Yeah, hats off to all of them, and hats off to all the lovely ladies of G100 for being here and making this happen. Thank you.
Thank you.
Wonderful.
Neeraj, thank you. Thank you for smiling at the end of the session. Thank you. You look beautiful.
Thank you.
Very much. Thank you, everybody. Thank you for being
Thank
here.
you so
Kalyani,
much.
you. I mean, this huge effort. It's her effort that we are all here today. And thank you, doctors. Thank you, Indu. Thank you, Nirja. Thank you, everybody being here. And of course, we are going back with so much of information. And in our own little way, we can pass on this information to so many more people around us. Thank you.
Thank you all. Most importantly, I will upload this session completely on our YouTube channel and share the link with you. Please, please, please share it with all your friends, with all your relatives, because any and every lady needs to know about this.
Yeah.
And the information which each and every doctor gave us is very, very important to break the traditional and religious myths, and to go about adopting the right way and right mindset to address the issues they are facing. So thank you one and all once again on behalf of the entire G100 mentoring and motivation team. Thank you so much, and looking forward for our next amazing, beautiful session, which will happen very soon. Love you all, sisters. Loads of love. Thank you so much. Bye bye.
Thank you, Kalyani. Thank you, Anupama.
Bye.
Thank you
Thank
all. Bye.
you. Bye.